profession is a health care. We are over 500 membership in the River State. And this is just enlightenment and awareness. What we do actually is to make sure that whenever we have any public health concern, anything that has to do with your health, my health, the health of my neighbors, the health of my brothers and sisters, we will come to learn our skills, our knowledge, our training, and even our money, the little money we have, to make sure. Why? Because it is our passion to make sure that every one of us live in health. Can you clap your hands together for that? Thank you. Thank you. So here in our midst, you know, in this profession, we are so large. So we have chapters, and we have also, of course, we have branches, chapters, and we have directors in our midst. I'm going to quickly welcome the chairman of the Association of Female Medical Laboratory Scientists, UPTH chapter, in the person of Dr. Justina Wena Emmanuel. Just give them a wave. Put your hands together for her. Powerful woman, I tell you. Powerful woman. And also, we are the female arm of our profession, the Association of Medical Laboratory Scientists of Nigeria. And here in our midst, we have a chapter chairman, powerful. We call her Excess Capacity. So the chairman of Association of Medical Laboratory Scientists of Nigeria, UPTH chapter, in the person of Comrade Mrs. Ngowari Owubokiri. She's your sister. Please greet them in your language. So for you to know that your sisters too, they are practitioners of this profession. You're welcome, ma. And we also have the chairman of, those people are business people, they are private practitioners. They don't work in the government sector. They are there to do their own, practicing this profession. So we have GMLD chapter chairman, the person of Mrs. Rejoice Obia. Is she here? You're welcome, ma. And we also have our wonderful, beautiful, another chapter chairman. Have you heard of the University State? Okay. So we have our female medical laboratory scientist chairman too. She is Mrs. Abiye Isioma Chiladish. Is she here? Give them a wave. She's another of your daughters. So we are here together. And also we have a lot of directors here. We also have, lest I forget, I cannot forget her powerful woman. I call her General because she is so. She makes things happen in the profession, both in the state and in her church. She is in charge of primary health care center in our association. She's the chairman there in Port Harcourt. This Doris Oluo. Can you wave your hand again to them? Directorate level. Is it not so? Yes. So we have some directors here. So as I call them, they will just stand and wave their hands. Okay? So right here, Mrs. Ijoma Obi, can you raise your hand? There are deputy directors here. And also we have, we also have Mrs. Victoria Badom. Can you just raise your hand, give them a wave? Let me not forget to, because recognition is very important. My people know me so. And also we have Mrs. Stella Okwele. Can you raise your, Dr. Mrs. Stella Okwele, Deputy Director. You're welcome, ma. And my wonderful and beautiful sister, Mrs. Blessing. All right. Thank you, Ma, for coming. And we also have some executive members of the association. We can't do without each other. They are there, that they are the ones making things happen in the States. So we have the Vice Chairman, Dr. Josephine Palap. I hope we have to spend with you here, we are going to accomplish much. We are going to leave a message to you that you will be practicing daily, and it will improve your health. Thank you very much.
Okay. We just got our recognition from the staff chairman, ADMLS, Meiwari Jumbo. So let's just put our hands together for her. All right. So at this point, forgive me for just speaking only English. I go fit speak pidgin. And here in our town, we don't come to tell on our plenty things about on our health, but we want they very specific, very direct to these common things where we know they see them as big thing, meanwhile not big thing. So now the reason why we they here. So in as much as we they speak English, we go they speak pidgin, they align so that all of us go understand why we they here. If you understand, just wave your hand, say I understand. Okay, that's a good one. Okay, back then we are going to opening remarks. Still, we are inviting our state chairman, ADMLS, Meiwari Jumbo, to give us an opening remark to open this sensitization, to open this very program here. May she can give us full gist.
My people of Okochiri, I want to welcome every one of you again. So you are all welcome, our mommies and our daddies, and our little children, we all welcome you. It is because of you we are here. And you ask, why are we here? We are here as an association. And who are we? We are the Association of Female Medical Laboratory Scientists. If I ask one of you now, who are medical laboratory scientists? Sure, you know who we are. Can I have a wave if you know what we are practicing? We don't know. Okay, let me explain to us. Medical laboratory scientists, you know the hospital. The hospital is made up of many different healthcare practitioners. No be so? We have the doctors, we have the nurses, we have the medical laboratory scientists, we have the pharmacists, we have the physiotherapists, we have different cadre of professionals. What do? Every one of them work as a team to ensure that if you are sick and you go to the hospital, you will come back home a healthy person. Put your hands together for the healthcare practitioners. That is what we do. So everybody has their specific role that they are playing to make sure that when we go to see the doctor, the first person they will see is a clinician. A clinician will take their history, ask them what is wrong, how they are feeling. The next person that is going to come into the management of that patient is the medical laboratory scientist, because the clinician will want to know what is wrong, what is the thing that is wrong with that patient. They can suspect because of their training, but we have to confirm. Because we are in the diagnostic sector, we will confirm what is wrong with that person. So we work as a team. So when we now confirm by carrying out investigations, examinations from the fluids from our body. What I mean by fluids from our body, it can be blood, is it not so? It can also be stool. Do you know what is stool? Do you know what is physics? Thank you. We are all educated. You're going to hear more about that. So, urine, pus, everything that comes out from your body, the way God has made it, when we look at it with our microscopes, we are going to see a lot of things that is wrong with the person. If the person is okay, yes. But if there is anything that is wrong from those investigations, you will find out. Then we will write, this is what is wrong with this person. And we will now send. And the clinicians will now say, oh, confirmed. And they will now prescribe. I'm just telling you for you to understand, no, basically, okay? Then when they prescribe, then the pharmacist will come in to release those drugs. And the nurses will do what? Will dispense. Take it to your bed. Oh yeah, put them for spoon. For you to stay there, stand until you drink the medicine. Not be so then they do. So we work as a team. Now here we are. Why we are here is that we have heard that cholera has come again. Today you will know what cholera is. You will know the symptoms. You will know everything, how you will prevent it. So we are here to carry out enlightenment program about cholera and how you will prevent it. Because as I'm talking to you now, a lot of persons confirmed by NCDC, Nigerian Center for Disease Control and Prevention in Nigeria. Those people that used to give us data. If there is anything happening in the country concerning our health, NCDC are the official people that release data of the incidents to us. And they are in charge of surveillance and monitoring of the disease. You understand? So they have given us data. That is why we run. Come say, make we begin go. For any community we tell us to come, make we go enlighten our people, say, this disease don't come. Oh. So about 200 plus persons, as I'm telling you, from January, don't die for Nigeria because of cholera. And more than 5,000 suspected cases now they don't record. And why you see say the figure low like this now because really we know they take data of every incident. If I ask you now, say your children, your pikin or you, where don't stool, vomit, where you go roadside chemist, hide them, pharmacy give you medicine, you go treat, you don't know wetin do am. You don't even know. But if to say you present yourself, then for record them, the incident level for don't big pass as we don't have now. So it is very dangerous. As I round up so that we will start to show you what we mean now. Right, over 34 states of the country, we have recorded incidents. And more so, we don't hear of cases in Bayelsa. We don't hear of cases in River State. But we never confirm them. That is, the people get those symptoms, but we never confirm them because they never come out, can't go where we go confirm them. That is why we run. Cholera, they kill past anything in hours. If they don't give you proper treatment, few hours, as you begin the purge, water, you go see how the purge dey, the color, everything today, you go see them. As you begin the vomit. Sometimes blood self go the day for the vomit. Before you know, dehydration don't set in. Before you know, you don't enter coma. Before you know, what thing happen? The person don't, what thing they call am for vernacular? Bye. So that you go understand. So we know they here to joke. It is a serious business. We don't want what happened in COVID period to happen now. And I want to let you know that preventive treatment or management, let me put it that way, management is better, far better than curative. Because you don't know the end, the outcome of that curative treatment. And it's more expensive. You go spend money tire before you get your health back. But that little thing that if you obey us today, that we will tell you, go and be practicing it daily. You go see how your health will improve. Even in this current, the one to we don't add monkeypox, we don't add to the cholera where we they talk about. Another one don't come on. And we will also tell you, say, now only small practice. That instruction where we will give you about the kind of bush meat and meat and your proper hygiene that you they carry out. If you can do these little things, I tell you, the overall health of our communities will be better. We'll have better life. We'll have better outcomes concerning our health. So that is what we are here for. And I want to crave your indulgence to listen attentively. I believe that some of you came here as representatives of your families. So you will take back the message home. Call those that are not here to come and join us as we begin. So you are all welcome one more time as you put your hands together.
Okay, that was a good one. Now we have been ushered into this very interesting and mind-blowing program. So now we know why we are here. So on this very issue, cholera, we have gotten a little briefing of what it is and how dangerous it is. But right now there is someone that has dedicated time and has spent enough time, resources to learn about this thing. And now we want to usher that person in to give us more education, to pieces this whole thing, so that we go know what we supposed to do, what this thing be, and how they take come, and also how it starts. Plenty things there. They say health is wealth. So when you don't get health, you don't get waiting wealth. So now we want to welcome Comrade Mrs. Ngowari Jeremiah, AMLSN, UPTH Chairman. Put your hands together. Put your hands together. Put your hands together.
Thank you very much. Eyamenapu aro kere ni me. Apigo kere ni me. Amasenapu apigo kere ni me. Thank you very much. I want to specially acknowledge the presence of my state chairman, my powerful sister, ADMLS, Miewari Jumbo, meticulous to a fault. I want to acknowledge the presence of all the state ESCO, the vice chairman, the secretary, our deputy directors in the house, the chairman AFMLS UPTH, the chairman AFMLS GMLD, the chairman AFMLS ROSU, and the AMSIN chairman Primary Health. I acknowledge your presence, and I'm here to make a presentation on cholera outbreak, prevention, and eradication. My name is Owubokiri Jeremiah Ngowari. I'm an assistant director in the University of Port Harcourt Teaching Hospital. Politically, I am the chairman, Association of Medical Laboratory Scientists, UPTH chapter. So please, we are all professionals here. I want to particularly tell you, my brothers and my sisters, to call your friends, call your people who are not here. The information we want to pass to you, it's something that will help you hereafter. And we do not just want people to come here because they want to receive gifts from us. We want people to be informed so that they can help improve their health and help, eradicate this cholera outbreak in Nigeria. We don't want it in Okochiri. We don't want it in Rivers State. So that's why we're here. So to the topic, please. We are talking about cholera. Now, what is cholera? We said it's an acute diarrheal illness. Acute means the onset is short. It's not chronic. It can happen within the shortest possible time of incubation. And it is caused by infection of the intestine with the bacteria Vibrio cholerae. So Vibrio cholerae is the causative agent. When you go to the laboratory and you culture and you want to know what causes it, that is the microorganism, the bacteria that causes it. And we say that cholera is an infectious disease. That is to say that one person can infect the other person. It's contagious, to so say, and it causes watery diarrhea. The poo that will come out will be watery, water, which can lead to dehydration and even death if untreated. It will make all the body fluid, your body fluid, to drain out, and it can lead to death if you do not handle it quickly. Next slide, please. Now, I said that the causative organism is Vibrio cholerae. Now, what is this Vibrio cholerae? Where can it be found? How does it come about? Science have shown that it grows in salt water. It grows in
Please, I beg your indulgence for that interruption, but it's very important to give honor to who honor is duly deserved. So we want to welcome a representative of the palace to come and give us their fatherly welcome. He is a person of Engineer DKT Omubo. Please, a hand of applause for him as he comes. You're welcome, sir.
Thank you very much. Yamna pokrini me. Obolasa. Please permit me to use my dialect on them. I'm Yabaka say no me. On this short period of time, it's not your making. This house could have been full very well. It's not your making. But I believe by the time we go far, more will come. Japu Bobia. And I'm so happy about what they came for. Though that is what has been happening about 2-3 weeks ago about CHOLERA. We heard it from Lagos and other states. It jumped into Port Harcourt. It did not even reach Port Harcourt. It crossed Port Harcourt to this Okrika. And we have arrested about 6 cases. And immediately we do it and everybody was saved. And this is to alerting more of you. I'm the WDC chairman in this Okochiri Ward 5. So we are still on it. We are so happy for you people to come in. Though we didn't, I just heard you people now, and I have to leave what I'm doing to run down to this place, so that this thing will go conclude. Thank you very much.
Thank you very much, sir, Engineer DK Omobo, from the palace. So we thank you for that representation of our dear king. You're welcome, sir. So as we continue, you have heard from what the CDC deputy chairman has told us. He has given us a vital information. Suspected cases here. It was confirmed, sir. It was confirmed. Cholera. So you can see that we came at the right time to arrest it so that the incidents will not increase. Do you agree with me? Thank you. So listen attentively as our sister continue with this training. God bless.
So, I continue. Thank you so much from His Royal Majesty. We acknowledge your presence, sir, here. So, talking about the Vibrio cholerae, I said that this is the causative organism that is behind. There are several serotypes. They said over 150 serotypes have been identified. And amongst them, 2 are very virulent. Serotype 1 and 139, 01 and 0139. And then these virulent serotypes have been sub-classified into 2, the classical and the L-TOR. Next slide, please. Now, let us redefine cholera. I know that the people here may understand what cholera means, because I know that my mother will tell me that during the war or immediately after the war there was outbreak of cholera in Okrika and a lot of people died. So the older people may understand what it means, but to the younger generation, what is cholera? We say it is an acute diarrheal infection when you start to poo suddenly, and that it is caused by an infection of the intestine with the bacterium Vibrio cholerae that I just mentioned. We said it is spread by the injection when you eat contaminated food or water. When you eat water that has been infected with this Vibrio cholerae, or you drink water that is infected with this Vibrio cholerae, and because Vibrio cholerae can be found in salt water, it means that even fish that can be infected, or shell food, something like esam, can be infected with this Vibrio cholerae. And we said that the symptoms might be mild, sometimes mild, but oftentimes it is severe and life-threatening. When it is mild, it can be handled. There will be no fatality. But when it is life-threatening and severe, it can lead to death. It can lead to death. People have died as a result of cholera, and especially children. Please, the next slide. Now, in Yemen, sometime, this was the statistics that was given. 815,000 persons were found to have cholera. This is global. I'm going global, worldwide. You know, to find cholera was discovered in that community or in that country by WHO between April 27 and October 10th in that year. Then amongst them, 1 million were children, while 2,156 people died from the infection. Now, amongst the 1 million people that were infected by the cholera, 600,000 are children. So you can see that children are more at risk. And we know that for any community, for any society to be healthy, there has to be children, because they are the leaders of tomorrow and they are our future generation. Amongst the children are sitting great destinies. So we will not want them to risk themselves to cholera. So the next slide, please. Now, bringing it down home. Cholera, as of today, is, you know, an illness that government is taking so seriously. And once cholera happens, there is now daily reports and there is daily statistics. So this table here is showing the report of cholera for weeks 1 to 32. That is sometime in August 10th or 11th. As we go on, we will see it. Now, amongst the states, these are the states where you have suspected cases. The smallest there is Imo State. You can see it. They have 80 suspected cases, but you have over 5,292 persons that have cholera in Nigeria. And look at our sister states there. Bayelsa, they have 481 cases of cholera. So you can see that the disease is not far. Our guy here has already confirmed it, that amongst us that they have discovered 6 persons who maybe was not reported to the CDC, so that the table will be updated. Next slide, please. Now, concerning cholera report, I said that cholera is WHO red alert health infection. So anytime there is cholera, they treat it as epidemic, like any blood hemorrhagic disease like Lassa fever and all that. So there is a table here showing cholera situation report, comparing what happened in 2023 and what is happening now. Now you can see that last year, 2023, suspected cases was 2,862, while in this year is 5,951. So this year there are many more persons that have had the infection compared to last year. Now, last year, the number of people that cholera killed is 86 in Nigeria. In this year, is 176. So you can see that the number is increasing. That is over 100% increase, 105% increase fatality case of people that died, you know, last year by the disease, by the infection, I beg your pardon, and what is happening now. The next slide, please. Now, host factors. Who are the carriers? Who are the people that, you know, this cholera can pass through? It said children Adults, elderly, everybody is at risk. But children are 10 times more susceptible. Children are more at risk to this cholera infection than any other group. Then, of course, you follow the elderly. That is because their immune levels are already compromised. Now, for people who have immunosuppressive conditions like HIV and all that, they are also more at risk because their immune levels are low. Then, there is interesting thing here. Look at the blood group. Blood group O. I'm sure that many people here know their blood group, but cholera has also been linked to blood group. They said blood group type O, the susceptibility is higher than blood group type B and blood group type A and then blood group type AB. I'm not saying that if your blood group is AB, then you should just be eating anything you see. You should not take caution. Please also take caution. But we are saying that by statistical analysis and by statistical findings, this is what science have discovered for us, that people who are blood group type O are more at risk. The next slide, please. Now, clinical manifestations. I beg your pardon, please ignore the mistakes. They are pictures, they cannot be edited. Cholera is extremely virulent. That is to say, it can kill fast. It can kill fast. It can cause severe acute watery diarrhea. We have established that before. And it takes between 12 hours to 5 days for a person to show symptoms. So some people, maybe because of the level of their immunity, may not reveal the symptoms for like 5 days. But that doesn't mean that they are not carrying the infection. And we said that it is an infectious disease. So the person's droplets, the person's poo, the person's vomit during that period when he's a carrier can still infect another person. So, next slide, please. Now, this is the typical rice water diarrhea. You know, most times, because of our terrain, especially where I come from, I am from Okrika, and in the way we build our toilet systems, not for this young generation, we used to go down to the toilets. We build it away from the town. So we go down to the toilets. It's like you drop it and water takes it away. You drop it and water takes it away. So if you are stooling watery stool, you may not appreciate that this is what you're passing out. But I want you to know that especially babies, children, when you begin to see that poo that looks like akamu, that it's drawy, slimy, please don't keep that child in the house. Don't try to manage the condition in the house. Make sure that you take that child to see a clinician, because it may be more than what you can handle. And aside from that one, you are also making other people to be at risk. Because since cholera is infectious, other people that are cleaning without knowing, where you drop the, if it is a diaper, where you pour the water, where you pour the vomit and all that, people may contaminate this condition. I believe by the grace of God that we will not face things like that here in Jesus' name. So please continue. Now, diagnosis. When you come down with the condition, There are two phases of the diagnosis. The first part of it is clinical diagnosis. The second part of it is differential diagnosis. The first part of it, the doctor now begin to assess the condition based on what you have eaten, where you have traveled to, then the clinical manifestations, what you have presented with. Then the second part of it is the one they look at in the laboratory. Now they begin to do investigations and rule out that this thing is what it is that they are trying to establish. Do you get me? So the next slide, please. This is what clinicians or laboratory scientists will collect from you when you come: rectal swab, catheter method, blotting, paper method. Continue. This is what we do in the laboratory. The clinical microbiologist or parasitologist, when you come in with your stool sample, will do a culture for you and look at the growth pattern there. This is what will be seen in the laboratory to confirm that you have cholera. So the next slide, please. Now, what happens when you understand that you have cholera? What should you do? You should notify, like as Oga have said, if it's connected with the medical people here, not in this house because we are visitors, we are living, but I believe that there is primary health, there is the general hospital. Once you discover, you notice that your stooling pattern has changed and it has gone from watery to that very watery pattern, you should notify. Why should you notify? Because it is through this, your notifications, that government come into it and begin to help in monitoring daily, weekly, monthly, annually, and come up with data. The next outline, please. Now, the mode of transmission. How can you become infected? By, fecally contaminated water. That is water that cholera droplets, the Vibrio cholera, it's found in that water that you are drinking. I'm sorry to say that what is prevalent these days is what sachet water that we call pure water, but we do not really understand where they come from and how they purify them. You may be, if you observe or if you sense them, you may discover that they are contaminated, some of them. Then contaminated food and drinks, especially fresh food like fruits, like leaves, like some, like fish. If you want to roast your fish and eat, roast your fish before eating, roast it well. Don't eat it half done. If you want to cook your vegetable, people say cook it half done, but at least let it be done. Don't eat it raw like that. And if you have to eat salads and all things like that, please wash well. Also use salt water to wash again. Then direct contact, of course, from somebody who is already suffering the cholera. That's direct contact. The next one. Then, I have said that cholera kills children more than adults. So children are more susceptible to the condition. And therefore, children have to be protected. And their symptoms are usually very severe, very severe. In fact, in the hospital, when you come with a child that is suspected to have diarrhea, they treat very fast. They replace the fluid and all that. Why? Because if you leave a child, because the child is so small, his body mass is very small. So in relation to the water that is inside of him, if you allow the water to drain out, what will happen? The child will become so dehydrated, and then, it will enter into shock, then drowsiness or coma, and you may not be able to recover the child. Hypoglycemia is another issue in children, and then convulsion. Then this cholera infection is not the same as rotavirus infection, even though they may appear similarly. So doctor will rule it out and give the child the proper treatment. The next one, please. Now in adult, you see what cholera has done to this man there. The eye has sunken in, please. I want you to look at it very well. If you can zoom it for us. If you can zoom, is it possible for you to zoom? Okay. You can see that the man's eye is sunken in. His hand has turned to apora. His hand has turned to apora. My professionals, apora is not in MedLab science vocabulary, but my Okrika people here, my brothers and my sisters, they understand what I have told them. So you will see that, there is a degree that clinicians use to check the level of dehydration. They will pinch and they will observe. And by the time they pinch and the flesh is not dropping, is not releasing, then they say that person is highly dehydrated. And look at the things that can happen to the person. Coma, cardiac and renal failure. The person's heart can stop to work. His kidneys can stop to work. And how do you know that the kidneys have stopped to work? Because there will be no more water in the person's body, or the plasma has become toxic. And why? What will happen? There will be almost no urine production. And of course, at that point, the person may not even be able to get up to make urine by himself. He may be placed on catheter, and there will be no drain inside the catheter to confirm that the person is going. So that's how cholera can kill an adult when not attended to. Next slide, please. Now, this is the cocoa of the matter. How do we control cholera? How do we control it? We have said that as health professionals, we are here to prevent the spread of cholera. That's why we are here, to sensitize you. That's our primary role, to let you know that this is real. Cholera is happening, it's real. It is something that is ongoing. But God has been merciful to us that we have not had so many fatal recorded cases, let me say it like that. Then what do? We advocate that you wash your hand, which will be demonstrated later to us, with soap and clean water. And that if there is no water, you can use hand sanitizers, hand cleaners, and use different levels of bleach. According to dilution, 2%, 0.2, 0.05. This is taking bleach into a cup or a basin and adding 2 parts of the bleach to 80 or 98 parts of the water. So that's how you get 2%. Don't mind this BB grammar that we are writing here. Is take 2 cups of the bleach and add equivalent 98 cups of that bleach. You have prepared 2%. If you do that twice, it's 0.2. So don't mind this drama. But what we are saying is, make sure that you clean your surfaces, your toilets, everywhere with a bit of chlorine, bleach. So the next one. Now, there is a roadmap that this cholera that is killing people up and down, anyhow, anytime they come, there is fear, especially in Africa, especially in third world country. Say in 2030 that they want to eliminate it, that we don't want to see it again. Now they want to end it. There is a road map strategy on that. And the people that are going after that work is Global Task Force Cholera Global Task Force on Cholera Control, and they partner with support countries to reduce cholera deaths, and Nigeria is one of the support countries. That's why we have the cholera report data And we have WHO working on it. The next slide, please. Now, 5 basic cholera prevention steps. When you want to prevent it, what do? You must ensure that you drink and use safe water. You must not be rich to use safe water. It is not only when you have dispenser in your house that the water is safe, or when you drink from the bottle that the water is safe. Hygiene matters, and my professionals will come to really demonstrate it. Drink and use safe water. Wash your hands with soap after you visit the toilet. Wash your hands with soap and clean water. And because of our terrain, here, this is for upland people. We do not bury our poo, except we use water closet system. You have to cook your food well, especially your seafood. I know that the only thing that your cooker man does not use Isam to cook is pepper soup. There is no soup that we cook that we do not use Isam. We use Isam is the second leaf in our soup. For everything, your buffalo choba is Isam. You want to cook native soup is Isam. You want to cook ofo is okra. Anything you cook, Isam is inside. And you see that Isam is implicated here. Isam is seafood though. And when I went out there, I saw atabala. Atabala used to, it's implicated though. So please cook it well. Cook it well. Especially those of us that eat it raw. For now, let us not be eating it raw. You know, when we used to peel it, as we are peeling it, especially that Elela Isam, as we are peeling it, when that yellow one that is very fine, we will just cut it and throw it in our mouth fresh. Please let us keep away from it now. So we keep our food covered, eat it hot as much as possible, peel our fruits and our vegetables. Then we clean up safely. This is where women come in. Please, I know that today a lot of women are career women. We find ourselves, trying to help our husbands so that we can bring income in. But however, please let us ensure that where we stay is clean and safe. Next slide. So isolation, this is when there is an incident. When somebody has been identified, what do? You notify the personnel, and what will they do? They can make shift. They have to bring the person from where other people who are not infected are, so that the infection will not cross to another person. It's not to say that they have ostracized you, but so that it is for your good and for the good of members of your family. They isolate you. They make use of every place, like town halls like this, school premises, just away from every other person. And isolation is important because until the patient is no longer infectious, until the person is well and fit to go home again, the person is supposed to be kept away from other members of the family. Why? Because the infection is contagious. The next slide, please. So we that are family members, when we discover that somebody has come down with cholera, what do we do? I want to start from the third point. You remove, because we have dealt with the first three. You remove and you wash any beddings, any clothing, anything where the person lie, any place where the poo-poo drop, any place, anything. What do you do to use to clean it? You use bleach. Use your machine. Usual machine detergents are sufficient. Bleach may not be necessary. You spin it, but however, after you have spun it, if you have machine, you still use bleach to. But if you use a machine to spin it very well, your bleach may not be necessary. But where you don't have machine, you can just put little bleach to rinse it. Then you use bedpans and all that. as soon as possible after being installed. Next slide, please. You can also use hand gloves. Why? Because the infection is contagious. Patients with cholera should not swim while ill with diarrhea or for 2 weeks after resolution of symptoms. Why? Because they are dehydrated. Another thing, because what is killing them is from the water. That Vibrio cholerae, we said it can be found inside salt water. We said it can be found inside brackish water. So it's not advisable for the person during when he's infected to be re-exposed. That's the reason behind that. So if a household member develops the condition, administer oral ORS and seek health care immediately. So as soon as possible is not something that you should manage in the house. You see your child vomiting, pooing, he has told you that he has vomited 3 times and he has pooed 4 or 5 times within 1 hour. It's not for you to say, don't do that. Please, don't keep him and say, make I observe him. Make I observe him. It may be beyond you. So please send the child to the hospital. The next one. So this is pictorial of how cholera can be stopped. You see, make your water safe. You can boil your water. You can cover the where you keep your water. Clean it, cover it well. I know that we used to have mono pump. That water is very good. So please, you can, when you fetch your water, that thing that you're using to drink water, always make sure that it is clean and that, you cover it well. You can boil your water, parboil, and drink. Then, you should prepare your food well, cook it well. You wash your hands very well. You also keep your toilets very clean. And then in events of cholera, please seek for proper medical attention. Don't take care of yourself by yourself. The next one. And so, that's it. This is courtesy of the Association of Female Medical Laboratory Scientists of Nigeria, Rivers Branch. We have brought this message to you to sensitize you and to let you know that cholera is around the corner, and therefore you need to take charge of things and know and don't fall victim to it. Thank you and God bless you.
Okay, from everything we've heard, we've learned a lot. So, if we have any question based on what we've learned, everything where you don't hear, where she don't talk, where she don't advise us, if you get any question where you want to ask, where you never still understand, we dey here to answer you. So if you get any question, just raise your hand. So we go give you mic. May you ask. Now who know nine sabi? If you keep quiet, you no go know. Like she don't tell us, say, when this person, somebody they near you, he get this cholera. No good to say, now my brother make I hide them. Now my pikin, no, people go laugh am. You no good. So in case you get any question based on what she don't talk, raise your hand so that I'll give you mic, make you ask. Anybody like that? Okay. You go just try, tell us your name and your question.
Okay. My name is Eunice Gibson Amapele. My question begins like this. What if someone the person live in a mud house? What if the person live in a mud house and everywhere is mud? How will the person clean? And the person don't stay in let me say, a house that there is style, how would the person clean that mud house? And you know mud, no matter how you do, that place will still be dirty. So how would you do with the house?
Thank you very much. Now, if you dey live for mud house, wetin you go do be say, mud, inside mud, vibro cholera no dey, but you go make sure say you clean that mud house. That one wey you dey call say no matter how you do, you no go clean, na dust, the particles of the mud, na you dey talk, but still need to sweep your mud house. If it is possible for you, floor the floor with cement at least, if it's possible for you, and still sweep. Still sweep mud, still sweep your house. Still sweep your house. Pour small water as we dey take do. Pour small water with bleach inside. Small bleach inside. Pour as you dey take before you sweep the house. Then inside your house, any surface where you dey take keep something, put small bleach inside water, clean that surface.
Okay, any other question? Okay. Your name and your question.
Good evening, everyone. My name is Deborah Kalayo. My question is, you said molo pump is very good to drink, but that molo pump water, even when you want to bathe it, if you pour water on your body and rub soap, if you just fetch the water and pour your body, the soap will just dry off. So I want to know, because you said it's very good, would that one cause cholera?
Mono pump water that I know, except where they drilled it is not, the depth is not enough. Mono pump water is supposed to be good. It's supposed to be ideal. But if you discover that one where they drill for you and you pour it on your body is hard, then it's not that good. It's not that good. So you need to boil it and before you drink it.
Okay, one more question, just one more. Okay.
You said about the feces, like where you throw away your feces. Okay, what about the mosquito? If they perch on the feces and let me say they bite you, will they give you cholera?
That's not the mode of transmission of cholera. I have told us the mode of transmission. Mosquito biting you will cause another thing for you. It's not cholera. Mosquito biting you. In fact, we have a professional in that area. Let her answer you.
It is cockroach you're talking about. It can pick. Mosquito will not. Okay? Cockroach, it flies now. So it can perch on that vomitus, that's the vomit. It can also perch on the poo-poo, and all flies, all those ones, but not a mosquito.
Okay. This should be the last question, please.
My name is Eze Wokocha. I am asking because many of our houses now in our flat, we do normally use hypo. Since person does not have anything like this sanitizers, how can we do in our flats for where you go to the toilet? That's what I want to ask, so that as I go home now, I start to change, to know what I'm going to do to my family. Thank you.
Sorry, thank you, Daddy. If you don't have sanitizers, at least you have water, you have soap. It's very common. As soon as you get to toilet, wash your hands very well. As you leave here and want to enter your house, wash your hand with soap very well. You don't need that one. If you can wash your hand like we'll teach you after now very well with soap, you're good to go. Okay? You're good to go. As you pull, some of us to wash water with bonbon with water and with soap. You're good to go. Wash very well.
Thank you very much.
Can we put our hands together for our beautiful self for this participation? Yes, it's good to ask questions. Okay, so we have heard a lot, and right now we want to go down to the do's and don'ts. What we should do to prevent this cholera, what we shouldn't do. We need to know these things so that when we get home, we can teach others. So that when we get outside our community, we can still tell people that, no, you're not supposed to do this thing like this, you're supposed to do it like this, to maintain a healthy society. So on this note, we want to invite Dr. Josephine Balap. Let's put our hands together. Okay, so it will be taken by Dr. Justina Wena. Please, let's put our hands together. Let's put our hands together. Okay, so please, in this very session, let us pay keen attention. Let us give in to everything, every instruction. Now who sabi, na in they know, okay?
Good afternoon, everyone. Good evening. I have less than 5 minutes to wrap up on this do's and don'ts for the prevention. But before that, we'll just watch this little video. It's about, we'll talk along what the
sickness wey dirty water, food wey don't spoil, or vegetable wey dem take dirty water go dey cause. If you no get where you fit get clean water, you fit use the one where you get, treat am well well.
You can see that stream to get water.
Take filter the water where you get.
Him or her, that is water, is already contaminated. And for our do's, we are expected to use clean water for drinking. And for our don'ts, we are expected to avoid contaminated water. Just as we talked about it, the tap, we are also expected to boil the water. Some people have special decontaminants that they use to ensure that the water is clean. So basically, we know that cholera can be gotten either through the water we take in, the food we eat, or through direct. One don't we have is that we should use food are well packaged. The second, avoid is a common practice, especially in the northern area where they drink unpasteurized milk. It can also lead to contamination and advised to employ good. We are also advised to employ good hand hygiene, because when your hand is contaminated, you can also directly transfer the infection or the causative agent, which is the cholera, into yourself or to people around you. In general, we are expected to maintain good sanitation. We are expected to ensure that we keep our environment clean. Another do is that when we see any suspected case of cholera, first of all, get yourself hydrated immediately, either through ORS, and then the next action is to run to the hospital. So we can see that cholera causes, after the person has been infected, there are a lot of stooling, there are a lot of vomiting, and the person gradually loses minerals, body fluid, especially potassium. When you lose so much, when the potassium level becomes very low, it impairs with the functionality of the neurons, and that inadvertently affects the heart, which can lead to coma, as our sister already told us, and finally death. So in general, we are expected to maintain good health hygiene. Thank you very much. So in general, to recover from cholera, we are expected to rush to the hospital whenever the condition presents. So I want to encourage us, just as our sister have given us a detailed information about cholera, to put in our best, especially our mommies and daddies in the house. I hope say una hear wetin I talk. Una dey hear me so? Then say make we dey use clean water, especially water where we dey drink. Make the water clean well. No go drink water where they contaminated. Even this one where they call pure water, some of them we don't know where they carry and come from, and how they take arrange them before they come package and put inside that packet. As in there for the packet like that, the surface self be done they contaminated. And you know the normal way where would they take drink them now? You go just collect them, use your teeth, tear the tin. One way you don't drink them. If the tin they there, the thing don't go. But if now water where they well package, or you cook the water, boil and well, drink them, you go see say that bacteria where they cause the thing self don't die before that time. So make sure say you drink clean water, no drink contaminated water. Secondly, if you use toilet finish, as you dey comot for the toilet, before you comot, wash your hand. Or as you come out immediately, wash your hand. Make your hand dey clean. Now the one they call good hand hygiene. Then go explain for us how we go use arrange our hand when we dey wash am. My sister will just talk that one, another 3 minutes. The last one be say, if pikin dey stool, or you self adult dey stool, dey vomit, make you no stay for house, dey arrange am o. No stay for house, go buy my medicine for chemist. Say make I just dey manage this one. Then they manage death o. Once person don die, you don die, go be that. So if you get any symptom, you dey stool, you dey vomit, quick, make sure say you take that ORS, gather strength. The next energy where you get, carry am, rush go hospital, make them treat you well. So in general, make we keep our environment clean. Cook our food well. As we dey cook am, make we cook am well, make it done before we chop am. You want eat fruits, wash am well too. Some people they use salt wash am, or you fit peel the back comot. But if na vegetable, cook am, make it done. So with all these things why I don't talk, now im be the do's and don'ts to prevent cholera and what to do even when there is a suspected infection. Thank you very much.
Now we have heard a lot about cholera, we've heard about the prevention. Right now we want to go down to the practical. We don't hear. Now we want see. We want see how we go take the sanitize our hand, how we go take the washer, make it clean. Even for us when they carry long nails too, make we see how we go take adjust them. So on this note, make I call Dr. Joseph Palap, make she Josephine Palap, make she come teach us what we suppose know.
Now, good evening. And so many things have been said about cholera this evening. Mine is just a demonstration on how to wash your hand. You can agree with me that washing of hand is the most important prevention of this cholera.
Hello. Okay. Good evening, everyone. I love people smiling because I smile a lot. Okay, before we do that, I'm going to join my sister to do that. Before we do that, one of our directors want to give us a word to add so that we go drive home waiting with the talk. So can we welcome Mrs. Victoria Badom? Clap your hand for her now. Thank you.
Good evening, everybody. I just want to add my voice because we've been talking about clean water, clean water. A lot of people here will be thinking of maybe going to buy packed water every now and then. Even me, as a lab scientist, I don't do it. I just want to tell you that it's something you can do in your house. Just get a pot, dedicate it to, this is for water, drinking water. Anytime, just put water there, boil it, keep it aside and allow it to cool. Because you don't have to bottle water that is hot. As it cools, you wash your hand very well. Fill it in bottles and keep aside for drinking. You don't need to go and start looking for money to buy packed water here and there. Even the packed water itself, we are not guaranteed about the level of safety in the packed water. A lot of them are contaminated, especially the one we call pure water. So that's my addition. Another thing is that we are talking about ORS. I don't think everybody here knows what is ORS. I want to call my sister to come and tell us how we can prepare ORS. Because as we are told, that is the first thing we should do before we run to the hospital. Who among us? IJ. Deputy Director, IJ Obi.
Good evening, everyone. Are you happy? If you're happy, clap your hands. Thank you so much. A lot has been said about prevention of cholera, and we all know that prevention is better than cure. To prevent an ill health is less expensive than to cure the what? Ill health. So in the course of the presentation, my sister made mention of ORS. That is when you're stooling and you're dehydrated. That is the first thing you take to get strength before you start running to the hospital. Sometimes we can prepare it on our own using sugar and salt and a bottle of clean water. But with science, the ORS powder itself has been manufactured that you can buy from any of the pharmacy store. Then when you buy it, your own is now to mix it up with that clean water. The quantity is about 1 liter. That is 1 Ragolis bottle. You will now put the required measurement into that bottle, mix it, and then drink. You don't keep it for so long. That is what ORS does for us.
Please, can you say that again so that they will understand, please? Tell them again so that they will understand. They will grasp it very well.
Okay. I said before now, we used to prepare ORS in the house. True or false? They will say use 5 cubes of sugar, 2 level teaspoons of salt in a bottle of Ragolis water. But some people will make mistake in measuring it. Some will use very small teaspoon. Some will use very big teaspoon. Okay? But now, ORS powder is sold already prepared in a packet. So when you buy it, your own is now to mix it into 1 liter. And what we use as 1 liter is that Ragolis bottle. The big one, not the very big one. The medium one. So you empty it into that Ragolis water and then mix it. Then we are talking about clean water. You can boil your own water, allow it to cool, and then put it in that container as your own measurement and empty that ORS powder into it. Mix it very well. When you mix it very well, it will just be like normal water. And then you try to drink it. The taste is not too sweet, but because you're using it to treat this problem, you will close eye and drink it so that you will get the results. Did you understand it? Thank you.
Clap for her now. Thank you very much. So if I call any person there now to stand up and tell us about ORS, how to prepare it, can you do that? You can do that. So that means you can prepare it at home. No excuse. When we say tablespoon are the one they take chop. Then teaspoon are the one they take turn, the smallest one they take turn tea. So when we say level tablespoon, you put the salt, make it flat, make it no. So now, do we understand enough to also know how to ask questions? So if you don't have money, no be excuse again to go buy ORS sachet. You can prepare it. Why we say go and buy? The only reason is that clean water, you may not, but now we have taught you how to achieve clean water. Is it not so? What did we say you should do to have clean water? Let me tell you something about boiling water. My elderly mom, when she will go, we like to make her to be active. So we'll encourage her to go and boil water. So she will go to the kitchen to boil water. She will tell me, the water has boiled though. I say, Mama. Then I will go close. Mama, the water has not boiled. She will say, no, it has boiled. I'm hearing soon. I say, Then I went to hear the soon. I didn't hear the soon. When water begins to boil, it is not boiled. When we mean boiled, it means 100 degrees centigrade. That boil means it don't do choco. The vapor don't they come off for the kettle, they come out. If you have the whistling kettle, you'll be hearing the whistle from your inside room. You'll be hearing the noise. You must run. Water is boiling. That is the boiled water that she will allow the kettle to start. They come out smoke. She understands better. So I know somebody too here has understood better. That's why we say go and buy it in case you will not know when your water has reached boiling point. Then you go and sharply, it don't boil low. You allow it to cool And you know, what will be the effect if you don't use boiled water? You will not kill some kind of bacteria that should be killed at boiling point. So we encourage you to either ask questions again to know how to prepare, because you have sugar in the house, you have salt in the house, and you have your boiled water, so you can prepare your own ORS. But if you have a little money, it's not that expensive, you can buy at the pharmacy. So let me hand over to Dr. Palap to continue, and I'll add up. Clap hand now, and no try.
Okay, thank you very much, my capacity chairman. Before I go on, I want to ask a question. You are coming back from work, your work or maybe market or anywhere, your food is already prepared on the dining or on the table. You are very hungry. As soon as you open the bowl, you saw what you love most. How do you react to that food? Do you wash your hands? How do you wash your hands? That is why I am here. Not only with soap, we have a technique of washing your hands. I need 2 volunteers. I need 2 volunteers from you. From the community, please. 2 people should come out, please. We are doing a demonstration, so we need to use it so that you go with you. Okay. You can cross, no problem. Okay, stand. Now you stand this way. Okay, so we are doing a demonstration on hand washing. You can agree with me that all we have discussed here boils down on hand washing. If you wash your hand very well, you will not contact. Apart from cholera, we have other diseases that you can contact if you don't wash your hands. We had Ebola, all those ones that have come and gone. It will come back again if you don't know how to wash your hands. So it will come back again if you don't know how to wash your hands. Please, can I, okay, there's no water. But what you should do, one is, this is your hand. You are supposed to have a running water. A running water. Please, you can have. Okay? You are supposed to have a running water. If you don't, excuse me, hold on. If you don't have a tap, that's why I'm calling you to stand. If you don't have a tap, as you come back, it's because somebody can help you. Or if nobody is there, use a cup and pour. As you pour, you take your soap and wash. The washing is not just this wrist that you wash and stop. You wash, yes. You wash your hand very well. You, in between your fingers, you put your hands in between your fingers, up, down, because you can only wash the surface. In between the fingers still have some dirt, so you wash in between the fingers. If somebody is there, ask somebody to pour water on your hands. You pour, you wash very well, you throw away the water. On no account should you use only water without soap to wash your hands. You have to use water with soap and wash your hands. Peradventure you are in the market, you don't have water and soap to wash your hands. Please get a sanitizer and sanitize your hands. As you sanitize your hand, it's assumed that 95% of bacteria has been killed. So you use it. You use the sanitizer to just sanitize your hands, and you do whatever things you want to do. That's just the practical aspect. If you do it clean, you will see that you will not have any problem. As you go home, you teach your children. Many people are not here. Teach your children how to wash their hands. Most time, you know, because of our terrain, we are living in the close to water. Most time we go to the toilet in the water. The same water will fetch. Just as they have told you, you need to boil your water. Don't just drink water from any stream. because that is where you have your problem from. But if you wash your hand very, very well, cook your food very, very well, this is not a time we will say we need half done. There's nothing I have done. You are leaf, you are fruit, nothing I have done. Please, the one that needs to be cooked, let it be cooked well. The one that needs to be washed, you wash it very, very well. And I believe that with this, you will live a healthy life. Thank you very much.
Want to appreciate the women that has come out for this demonstration. Thank you, our mama. Okay, let me add a little again to that. I will give you a scenario. We have told you about feces, stool, maybe that has been contaminated with the bacteria. Somebody pooed somewhere, maybe by the riverside or something, or by the street. We saw a lot of dirty gutters there. You know, that should not be. Learn how to clean your surroundings. So, flies, you know house flies now? And cockroaches. Is it not so? Okay. They will now go and perch. You know, they like such things, dirty places. That is why we say clean your environment. We did not say, we are not joking, no. Because when you clean, you will have less house flies. When you clean your environment, you will have less cockroaches. True or false? Okay. So when you have such dirty environment and house flies goes to use their proboscis and all that, their legs, let me put it that way, and perch on the feces, and or cockroach, they like dirty places, so they perch, they swim inside the feces that has been contaminated with this bacteria that causes cholera. They will fly, come into your house, to your kitchen, and they will see, they like good things, so they will now see cucumber, they will now see mango, they will now see, call all the whole vegetables, okay, and they will perch, apple, they will perch on it, and they will be rubbing themselves with their leg. All the cockroaches will run around your cucumber. Name any fruit or oranges. No, oranges, no. Cucumber and all those apples, mangoes in their season. After that, they will fly away. Is it not so? But they have deposited that bacteria they picked from that poo on your fruit and your vegetable. Inside your kitchen, inside your house. Then Paul comes from outside. Hey, after they had this walk, maybe school, hey, he's sweating, hungry, mommy, what do you have? What do you have? What is in the house? What do you have? Grab, pop, he picks the cucumber or apple, and straight with the dirty handle from outside, he will just pick that thing that has been contaminated. He will pick it and start eating. What has he introduced into his system and into his intestine? The cholera bacteria. Few hours after that, the next thing you will see him, Paul will be pooing. Mommy, toilet. Mommy, toilet. My stomach, toilet. The next thing, hey, what did they happen? You don't know, you're confused. The next thing you'll be seeing, vomiting, is zap. If you don't do something, the next thing, God forbid, nobody's answering Paul, Yabi, straight up, coma. Then you start rushing the person to general hospital. Then you start rushing the person. That is why what we are telling you, I'm just giving you an instance. So when you come home, Paul, as you come back to the house, as you just enter your house, the first place you should go is your kitchen or your restroom, where you have flowing water. If you don't have flowing water, you have been taught, call somebody that is in the house. Oh yeah, pour me water. As you enter house, pour me water. Wash your hand inside your nail. Wash as Mama has demonstrated. Wash well. Wash again. Use your dry towel or your paper napkin and dry your hand or air dry. Then you can go about removing your clothes. Please, that's the first thing to do when you come from outside. Do you know why? Somebody that has been infected with this bacteria unknowingly or carrying the symptoms, touch the bus. That bus you entered, that bus hand is infected. The taxi you entered, the hand is infected. Anything you use your hand to touch as you go outside, even the person you shake hand, is suspicious. So what do? When you get to your house, the first thing to do is to wash. Proper hygiene. Wash your hands very well. I don't know whether I am understood. If you don't, you will pack everything and you enter into it. Look, a lot of us do it. They say bacteria no they kill, African man a lie they kill. So when you come, Paul might be when he just land for house, he doing hand like this. See small basin of bowl now we used to wash our hand. He will put his hand inside the water as long as the hand is wet. Okay. As soon as the hand is wet, this is the last scenario I'm giving. As soon as the hand is wet, my brother and my sister, he go knock gari, he go mold the gari, hot gari, in it. That you know they kill African man, they kill. Clap hand for yourself for listening. Thank you so much. Thank you so much.
Okay, there's one scenario I've seen with mostly our elderly ones. If they are eating any fruit and fly just perch on it, what they will do is to bite that area and make it no waste. Please, it is wrong, it is wrong. Go and wash and eat. Okay, so as we conclude this important session, based on the love that these medical practitioners have for you people, they have some things that they want to present to help support this prevention of this cholera that we have heard of today. You know, say now one thing to tell you, say you need to prevent, and another thing to provide what you go use, prevent them. So now we'll call on no other person than the state chairman to come and present some things that we will receive to prevent this cholera. Let's put our hands together for ADMLS Mewari Jumbo.
Thank you very much. We have come a long way, and we have come with love to give you this message, teach you, and also enable you. We are not saying that we will give you everything, but because of the love we have for you, we will give you a support so that you also add to what you have and also continue to do what we have told you to do. Thank you so much. So it will be passed to you as you sit. We will be passing it. We have soap that will help you to wash your hand. Please, it's not, just use it for washing hands so that it will last. It's not for bathing. So please, just keep it that this soap is for washing of my head and my children's head. It's not for bathing so that it will last a little. You know, the condition we are now, we have to help each other, okay? God will help us. So the liquid soap also is there. So they will start passing it. Just start giving to them. And the bleach, we have taught you how to dilute your bleach and clean your surfaces and floor and your restroom, that's your toilet. So please, this is just a token of our appreciation. They will start passing it one. Anyone will get to una beg, make una no vex. It's the little we can do now to support the people that came. Okay, please, let's do it sharply because time is not on our side. We need to go back to Port Harcourt. Let's do it quickly. Please, as they give you, just collect whatever reaches to you. Just collect. And we want to appreciate, with immense appreciation, appreciate the King of this kingdom. We appreciate him for his support, his approval, for us to come here to help his people, and for his support. So, it is a really great privilege for us to have such an understanding monarch that enabled us to be here. Everything that we have achieved here is through his enablement and his support. So we want to say, may God bless the king and may his reign bring more prosperity to his kingdom.